Well, we have a big day on Rising, here to discuss a wide range of issues surrounding COVID-19 and the growing concerns about monkeypox is Dr. Anthony Fauci. Dr. Fauci, thank you so much for joining us.
Thank you for having me. Pleasure.
The pleasure is ours. We wanted to first discuss the BA.5 subvariant of Omicron, now the dominant strain in the country. I believe it is the strain, or it's believed to be the strain that President Biden contracted. What can you tell us about the development of variant-specific vaccines and more therapeutics?
Well, the therapeutic situation is a little bit more easy than trying to follow the variant, because most of these variants don't change in a way to evade the antiviral effect, for example, of the drug that's most commonly used called Paxlovid, which has been shown by a clinical trial to have a high degree of effectiveness, in this case, close to 90%, in preventing the progression to severe disease leading to hospitalizations and deaths. As we go from one variant to another, it becomes difficult to be able to predict precisely what that variant would look like. But given that we are in a BA.5 mode, in the sense of more than now 80% of all the isolates are BA.5 and 15 to 16 or so percent is BA.4, which is a close relative of BA.5. The general trend will be that as we approach the fall, that the FDA has made the authorization that they would be looking at what we call a bivalent, which means a vaccine boost for the fall that would be comprised of BA.5 together with the ancestral strain vaccine. And that's the reason they call it a bivalent, because there are two components of that. That's a pretty good estimation of what we will be seeing in the fall. There's always the possibility that you're going to have the evolution of another variant, and hopefully if that occurs, it will vary off from the BA.5 only slightly, in the sense of being a sub-lineage of it and not something entirely different. But that's the situation you always face when you're dealing with a moving target. But the best guess right now would be, as we get into the fall, you'd want to boost with a BA.5, so that if you get BA.5 or something closely related to that, you will enhance the immunity against that particular variant.
Dr. Fauci, thank you so much for joining us. It's actually a huge privilege to be talking to you. Speaking of a moving target, we know so much more now than we did in March of 2020. I'm wondering if you could go back to March of 2020 and start over with the pandemic response. What would you do differently?
Well, if I went back to 2020 and knew what I knew in 2020, I wouldn't do much differently. If I knew in 2020 what I know now, we would do a lot differently, because back then we were not sure of a number of things. We were not sure really of the complete modality of transmission. We knew and started to get information at the end of January and the beginning of February that this virus could spread from an asymptomatic person. We did not fully appreciate the extent of that. We know now, 2.5 years later, that anywhere from 50 to 60% of the transmission occur from someone without symptoms, either someone who never will get symptoms or someone who is in the pre-symptomatic stage. Had we known that then, the insidious nature of spread in the community would have been much more of an alarm, and there would have been much, much more stringent restrictions, in the sense of very, very heavy encouraging people to wear masks, physical distancing, or what have you. We also were not fully aware, as we are now, that this virus is also spread by aerosol spread, which we did not fully realize at the time. There was some hints of that. So again, there are a lot of things, had we had the knowledge that we have now, that we would have done a bit differently.
You know, it's interesting you bring up the masks, and I know some places, LA County for one, is interested in bringing them back right now. But based on, what I'm hearing, many experts, I think, have conceded that at least the cloth masks are not doing virtually anything to stop the spread. I think there's, increasingly questions about whether these restrictions are making much of a difference, and then some of them are, quite difficult for people with disabilities, for children having to wear them in schools. What is your view of ongoing restrictions? Do you still think they're necessary? Would you still recommend those types of things, masks, some social distancing, some shutdowns, given that we're going to be facing this disease at this level of contagiousness for some time?
Well, for this level of contagiousness, but not necessarily for this level of viral dynamics and circulation. And that's the thing that you really have to make sure you distinguish when you're describing it. For example, the CDC has on their website a map of the country with different color codes: green, yellow, orange, and red. And when you are in a zone or a county, a state, or a city that has a very high level of dynamic of viral circulation, the CDC would recommend strongly that you wear a mask in a congregate indoor setting. And that would include schools, places of work, anything that brings people together in a closed environment. That is good public health practice. The CDC does not mandate anything. What they do is they make recommendations, because at the local level, you may have a very different situation in one region of the country or one county or one city or one state, very different from another region, city, or state. And that's the reason why the CDC serves as an analysis of the on-the-ground situation and a recommendation. Whether something becomes a requirement is something that's decided at the local level. With regard to your point about masks, you're absolutely correct. One of the questions that was asked just a moment ago of things that might have been done differently had we known what we know now back then, I think the masking situation is one that is really critical that would have been done differently. First of all, we did not fully appreciate that a well-fitted K95 or NK95 mask is much, much better than a cloth mask. And to wear a good mask, the data now are very clear that masks are very good at preventing both the acquisition of and transmission of infection. There was a lot of conflicting data back then as we were in the early months of 2020. So the recommendations were a bit confusing about whether to wear a mask or not, whether you should wear a cloth mask or what have you. Right now, we are very, very clear that masks do work in prevention of acquisition and transmission. But you've got to get a well-fitted mask that has of a high quality. And the two we know are high quality are an N95 or a KN95.
Dr. Fauci, why was mass antibody testing never part of your COVID response? Why was natural immunity never taken seriously? And do you consider that to be an error?
Well, you got to be careful. What do you mean by natural immunity never taken seriously? You're making an assumption that I can't answer the question because I'm not sure where you're going with it. What do you mean by not taken seriously? We were always aware that if you get infected, you have a degree of protection against reinfection. What was not clear then, but what is very clear now, that the protection against natural infection, as well as vaccination, wanes over a period of time. That is very, very different from some of the other infections that we deal with, such as measles and polio and the ancient smallpox, where when you get infected or you get vaccinated, the level of protection is measured in decades, if not a lifetime. So the people who were talking about natural immunity were making an assumption in some part, and not everyone, that once you get infected, you were essentially protected very, very well for an extended period of time. Then we found out that if you get infected and vaccinated, that hybrid immunity is much better than infection alone or vaccine alone. These were all things that evolved in our understanding of them, because we are indeed dealing with a moving target. And there was a lot of back and forth and criticisms and things that you were, I believe, referring to in your question to me, that in many respects is not fair. Because if you have a stable, static target, then you can start talking about what your approach, what your recommendation was it right or wrong? But when that target continues to change with new variants that elude protection, both from prior infection as well as from vaccination, then you've got to move along and be flexible and open-minded enough to deal with what you're dealing with in the real world is a very elusive target.
Yeah, absolutely. I guess the how I would respond to that is the perception that there's an openness to discussion and debate, or that it's okay to criticize the CDC or to disagree with them. It was not. A lot of people didn't feel like that, or they felt like if they did that, they're somehow anti-science, or they're being called out as on the side of the virus, or that kind of thing. Do you hear that criticism, and what do you make more broadly of the CDC's response? We've been very critical of the testing screw up from the beginning with the CDC, and now we have monkeypox, and it seems like once again the federal health officials weren't totally ready for this pandemic. I know, for instance, the FDA had some issue with importing the vaccines because they hadn't inspected the facility, exactly the kinds of errors that were made in the early days of COVID.
Well, first of all, I can only speak for myself. And I can tell you that I have always had an open mind to the comments of the community. I've developed that 40 plus years ago in my original interaction with the activist community with HIV. I always listen and take what I hear from the community. Sometimes that's incorrect and misguided, but sometimes it gives you important information and feedback from the real world. So I can only comment about how I look at things. When people criticize, I always take criticism seriously, analyze it, and see if there's anything I can learn and do better from the criticism. Sometimes it's outlandish, but sometimes there's a kernel of truth in that. So I have been making my own approach to this, which I've been doing now for decades, to always keep an open mind, which I still do to this day.
Well, go ahead, Batya.
I so appreciate what you're saying, Doctor, about the moving target. At the same time, there were authorities that made different decisions than the CDC's recommendations, for example, on school closures, and they did not see higher levels of child mortality when it comes to COVID. And meanwhile, the schools that did close down were now seeing just disastrous levels of learning loss among poor children, children of color, mental health crisis. I wonder if you would recommend locking down schools if you had to do it all over again.
Well, again, it's first of all, I didn't recommend locking anything down. You're asking me questions. You're talking about the CDC is the public health agency that uses their epidemiologists and their science-based approach to make recommendations. Clearly, whenever you close schools, there are collateral effects that are negative. I have always been well aware of that. And I have always felt, and you go back and look at my statements, that we need to do everything we can to keep the schools open and safe. And by safe means if you need to wear masks in that, wear masks, get better ventilation, surround the children with people who are vaccinated if a vaccine is available to help protect the children. Again, I have been on the record of saying that always try to the best of your ability to keep the children in school, but in a safe environment. Locally, a decision is often made when there is so much infection to close the school, but I would always see that as a last resort, and I have always felt that way.
Well, one other thing we wanted to get your perspective on. I know you said recently, and you said several times, that you are open to the idea of the lab leak theory. You think it should be investigated like any other. But I wanted to ask you specifically about gain of function research, of which you've been a foremost public advocate, and I totally understand that we don't know that gain of function research had anything to do with the emergence of COVID. But my question is, what do you think are the benefits of doing that kind of research? Because as far as I can tell, we did not get the vaccines or therapeutics from doing that kind of research. So if there's no real upside and there are risks involved, why do you think we should fund it?
Well, I think it's such a complicated situation that people use that terminology, gain of function, in a way that is not applicable in so many ways to what's being done. What you want to do is that sometimes you have to examine in the field and look at pathogens that are out there, and you need to work with them in a way to give great insight into understanding and ultimately protecting against the natural occurrence. We put guardrails up, and there have been very clear guardrails of what can and cannot be done by committees that have nothing to do. These are outside committees that were put together without input from so many different sources, OSTP, the national academies, and they came up with what the guardrails would be to be doing work on bat viruses and viruses that have been shown clearly to have evolved from the environment with SARS-CoV-2 and with MERS. You always got to be very careful when you're dealing with pathogens, and that's the reason why we put the P3CO, which is the pathogens of pandemic potential care and oversight, which were guardrails that were set up by independent groups, and we have followed those. There's a lot of misconception about gain of function as a broad general category, as opposed to, in a specific situation, to examine whether there or not the benefit for understanding more about the evolution of these outweighs any risks. And the risks that are taken are under the guardrails that I'm talking about. I want to make one point, because you bring it up, is that people talk about the research that was funded by the NIH. If you look at the viruses that was studied there, and we never get the chance to articulate that, usually because people interrupt and already start talking about gain of function, gain of function. If you look at the viruses that was studied and published in the peer review literature, any card-carrying virologist who knows about viral evolution will tell you that it would be molecularly impossible for those viruses that were worked on to be turned into SARS-CoV-2 by accident or by intent. They are evolutionarily so far from SARS-CoV-2 that would be impossible. Yet, when you talk about research that was funded by the NIH, people make an inappropriate conflation of those experiments with SARS-CoV-2. Now, having said that, do I keep an open mind that, in fact, somewhere beyond anything that the NIH has done with funding competent Chinese scientists, could there have been a lab leak as a possibility? The answer is, of course. Apropos of what I said a moment ago, I always keep an open mind. But you also got to look at what evolutionary virologists have been studying and published in the peer review literature. Something as recently, literally, that's going to come out soon from a whole group of qualified people, still say that although you keep an open mind, the most likely evolution of SARS-CoV-2 is a natural jumping of species. Again, always keeping an open mind, but you've got to go with the data. And that's what I've always done.
Well, Dr. Fauci, we really appreciate your time, you coming to Rising and giving your perspective on these issues, which we discuss frequently. We are so grateful. Thank you.
My pleasure. Good to be with you.
Thank you so much, Doctor.
We'll have more Rising right after this.